Okay, let's look at this case. This is a very tough case. Patient has a lot of reconstructive surgery, and you can see that with all the bars and pieces from a pretty horrible accident into her facial area, and the plastic surgery that needed to occur required a lot of metal hardware. I do come into cases like this where I do see infections around these screws and bars, and that's really, really important to get those patients back to a medical surgeon to take a look at those. So typically the bone is fused and already doesn't need the bars anymore. But they're very difficult to take out, especially in the facial area. So anyway, we don't have that concern here, but our biggest concerns are really the bone up here in these areas here. So there's just really no bone up in the sinus or below the sinus floor. We can look at the sinus floor here. It's super paper thin. And as we go along, let's go a little bit more towards the teeth. And it remains very, very thin here, coming through until we get to where the teeth start. And then here's where our teeth are. So we have a very, very thin amount of bone. And it's very, very difficult to, how do we deal with this? The other problem she has is kind of like the anatomy here, how much it actually angles out. And I'm trying to get right across the tooth, but you can see this is a really weird, or, it still kind of goes into my constriction ideas about how that bone is, the geography. So it's a very tight constriction kind of coming through here. The bone is kind of coming into this curved way. Very difficult when you're trying to put an implant in and still get the teeth in the same position, and then there's not really much bone there. The bone density is okay, but the constriction problem, there's a red sinus, there's attached tissues issues up there on the sinus in the posterior area. The ability for that area, when there's such thin bone, is nearly impossible to really grow bone. You'd have to have a lot of miracles happen in growing bone into those areas there. On the bottom has a little bit of constriction, has thin facial bone, but when we scan along in like this area here, there's still some bone here. There's a little bit more bone here than it actually shows. So I don't give it a complete red, I maybe give it an orange, but overall this is a very, very difficult case. And the best we were able to do is when we put in a couple implants, here was the issue when this tooth was lost, and we were able to preserve this area here and get an implant in here and get an implant in here. She still doesn't have anything here, but this is a very difficult piece of dentistry that has to be cleaned like crazy. This is an area where it's a one-piece bridge piece, and when they get decay here, all you're going to try to do is patch it until it's too impossible to save. And then we're looking at implants on the bottom. So her case on the top is nearly impossible to actually fix. I just recently saw her because on our implants, this is her original picture, but she was just in, and we have a cantilever on 2 implants to give her some sort of chewing here, but that loosens up maybe every year, and we have to re-cement it back in. But on the bottom, it's a very difficult case to deal with all of this bridge work here. When that goes, the only thing she's going to really have is to try to get an implant in maybe here. But the bone is fairly soft on the lower jaw, doesn't have a lot of structure to it either. So that's kind of a little bit of a miracle on this case here. Luckily, the nerve does run low. It's right down here, but the density doesn't look very good. So that's an issue. As we go along the jaw, we lost that facial plate from years ago where the extractions were, but the density looks a little bit better. And then when we come across the teeth here, we are looking at a little more density here, but this is for sure when this gets extracted. This is not an immediate placement case. On this one, you definitely have to graft it, try to preserve that amount of bone, in this case when these lower teeth fail. And really, you're looking at a 4-locator denture piece on the bottom. So hopefully we don't see that anytime soon. So far, things are pretty stable. But she's accepting of that idea that there's going to be a time in her life down the road that she's going to have a very difficult time dealing with her teeth loss or that bridge loss, and the time that it's going to take to get implants in is going to be at least an 8-month project. I talk about projects like this in bone healing events. Each bone healing event, let's see, try to get it, there we go. So here we have, so like each of these teeth that become extracted, here's our constriction on the upper. Here's where it kind of has splotchy bone-like teeth. We have a pin coming through here. We can't bring our implants that far, and we have to preserve the bone height as much as possible. So in this case, it's a minimum of a 2 bone healing event process, which means each bone healing event is 3.5 to 4 months in my case. And so as long as the medical history looks okay, there's nothing to extend that time period. That's the minimum time period I allow bone to heal around graft materials, and that we can place an implant after that. Other people may place the implant and graft at the same time. I don't like that. I believe that that bone quality is not the same as native bone to grow in there first, then you place the implant in. I think research supports the idea that that bone quality is far better than the bone quality is if you put the implant in, graft around it, and the bone comes around that graft to heal onto the implant. I think the quality is lesser. So that's a matter of opinion, really. I don't know if anybody has really proven it definitively in this case. But that's my treatment plan. It would take 8 to 9 months just to have the implants in, and it would be a full arch on the lower. And unfortunately, there's not much we could do on the top. We did get a couple implants in, like I said, on that upper left side. I don't have a current x-ray of that, but that is holding for the last couple of years. So, like I said, it just comes down to re-cementing and trying to maintain that site as clean as possible on that prosthetic. So that's a pretty quick and easy case because it looked really difficult in the beginning, but overall, because there's severe limitations, and then you're just kind of in a holding weight pattern and making sure that she comes in for the cleanings and increases her oral health care at home, there's kind of nothing we're doing so much on the bottom at all. So, great.